Welcome to the Parenting Then and Now podcast, the show that remembers the good and sometimes the not so good old days of parenting past. I'm your host, Samantha Kemp-Jackson from the Multiple Mayhem Mama blog, and every week we'll be talking about how things were then and how they are now, parenting through the lens of the ages, if you will. Now, whether you're a parent, a kid, or someone who used to be a kid, you'll want to stay tuned as we reminisce about the past, embrace the future, and marvel in the present how things have changed. If you're ready to glance back in time at kids, parenting, and the good old days, you're in the right place. So sit back, relax, and let's take a trip down parenting's memory lane. I hope you enjoyed this episode. When COVID-19 was declared a worldwide pandemic, none of us could have anticipated that we'd be in the midst of it for over a year. The effects that the virus has had on us, both physically and mentally, are considerable. The fear of getting sick, the reality that we're living with this situation for an indefinite period of time, and well, it's enough to make both parents and children just a bit stressed. In light of our new, or maybe not so new reality, Dr. Deborah Gilboa, also known as Dr. G, has some interesting perspectives. The family doctor has been working steadily since COVID hit, helping her patients cope physically and emotionally to this reality. Resilience is one of the answers, believe it or not, in addition to more practical medical solutions offered. Hello, vaccines, anybody? How do we function in this reality that we're living with that seems to be going on indefinitely? These are just some of the questions that I asked Dr. G during our very interesting conversation. Here's our interview. So welcome to the Parenting Then and Now podcast, Dr. G. It is so great to have you on the show.
I'm really excited to be here. Thanks for the invitation.
It's so wonderful. So just full disclosure, you and I follow each other on social, and I see all of the posts that you post about, medicine and kids and current events related to science and medicine. And I thought it was really important to talk to you because I feel that we're at a point right now, especially with COVID-19 and the pandemic, that there seems to be two camps of people in terms of those who believe the science and the medicine and what the best practices are with respect to how we should proceed to make sure that we damper down the virus, and then those who feel that it's their right to walk around without masks. But before we get into that, the whole crux of this podcast, as you know, is about the then and now. So before we get into the now, why don't you give our listeners and viewers a little bit more about your background? So where you grew up, what your childhood was like, how many kids you had when you were growing up in terms of siblings and now, et cetera, et cetera.
So I was born in the Bronx in New York, not too far, I think, from where some of your family lived when they immigrated to the U.S. I'm a second generation American. All four of my grandparents came to the U.S. illegally, and then, or rather, escaped where they were illegally, but were able to come in through Ellis Island.
Where did they come from? Where did they escape from?
Russia and the Ukraine.
Oh, wow.
Mostly running away from anti-Semitism, after pogroms, like two of my grandparents there. They were very young, newly married, pregnant, but didn't know it when their shop was smashed, like you do. Anyway, so there are a lot of experiences that I had. So I was born in the Bronx to parents who were born in the Bronx in the same buildings that their parents had moved to when they'd gotten there, or very close by in a tight-knit community. And then we moved following work, which is pretty common in the 70s and 80s here, that the nuclear family would stay together, but the extended family broke up as people went on an economic journey.
Right.
So we lived in Connecticut for a bit, in Ohio, in Illinois. And I had thought about becoming a doctor when I was a kid. When people would ask me what I wanted to be, I would say a pediatric neurosurgeon because I got a really good reaction. And then I dissected a fetal pig as a 13-year-old, as a freshman, first year in high school, and realized, that was so gross. I couldn't possibly go into medicine. And decided that there was a life for me on the stage. And I got really into theater. I went to university for theater. I actually graduated from university for theater and worked in theater and television for the next 4 or 5 years. So I worked and I got this job at Second City, and I was there for a couple of years, and it was the best job I was really ever going to get. It was really amazing. And then I decided this is kind of fun, but I maybe wanted to be a doctor when I grew up. Did my residency in family medicine. I'm a family doctor, which means that I see kids and their parents. But the big thing that happened to me is that I saw my own mom had really degenerative arthritis. And by the time she was 40, she'd already had her hip replaced, and she was already using assistive devices. And she is actually one of the few people I know to have died of arthritis, really. And and the way that impacted her and the way I've seen people's health impact them, I really started to figure out after maybe 5 years of practicing medicine that although it does matter if you have a doctor with whom you can really tell the truth, who asks good questions and listens to your answers, who works with you to find a plan that works for you and not just for the science, but also isn't afraid to tell you the truth about science and about what's happening with you. That all matters. But actually, the thing that really makes the most difference in people's perceptions of their own well-being is their resilience. And resilience is something that we have this really fixed mindset about in our society. We think, kids can get smarter if they work hard, they can get more athletic if they work hard, but we really think that if someone is sensitive or struggles with obstacles, that's how they'll always be. And that's shenanigans. Right? We can build resilience. It's not a character trait. It's a series of skills. And we can build resilience just like we build our reading or math or running. And so I got really interested in that. And that is the other thing that I spend all my time focusing on that you've probably seen more of online is what is it that we do that makes us handle what comes our way better?
And I will link to all of your online presences and details regarding resilience, because I think it's really important. So I think that's actually a really good segue into what's going on right now, doctor. So, we're in the midst of a pandemic. A very real virus has pervaded the world. I'm sure from your perspective as a medical professional and somebody who knows and understands the science, this is part of why I wanted you on the show, because I'm a very strong believer and proponent of listening to experts and listening to doctors and epidemiologists and immunologists and et cetera, because I live with a chronic illness, and the science is the science. There's no gray area. So what are you seeing with respect to how, what are you seeing with respect to how your patients are handling this situation, and what do you? I guess because this is parenting then and now, what do you see in terms of the difference in how people accept reality in terms of the science and the facts, and how it was when you were growing up, and what do we need to do now in terms of collectively as a society to make sure that we're all on board with the reality of how serious this illness is and what people can do? What do you tell your patients?
What I tell my patients, and I have to admit, still surprised that every day I'm in the office, one or another patient will say to me, "Hey, do you think this is real, this coronavirus thing?" And what my first reaction to that is dismay. Although also I recognize that means it hasn't touched this person's family yet. Yeah. And that's great, because we're not going to get out of this without pretty much everyone knowing someone who was made sick by coronavirus. And that's been true every time we've had a worldwide pandemic. It's about every 100 years. Like, we were due. That's one of the reasons that, for example, the leadership in our country 10 years ago really doubled down on our pandemic playbook, because it's fairly predictable that it will happen. Nothing else about it is predictable. Not where it'll come from or what it'll look like or how we'll handle it, or so I'm really glad when someone lets me know in some way that this hasn't touched them yet, but I'm scared because it is absolutely real. And a lot, years and years from now, they're going to study sociologically what happened in the world, because it's worst, I think, in the US, but it's happening also in Europe and to some degree in Canada, that we've gone through 15 years or so of starting to give feelings and beliefs the same weight that we give facts.
Yes. And this equal sides thing does not,
right.
It shouldn't exist when you're dealing with scientific facts and supposition by some people. So some people think, well, I think my opinion is that it's not real. And that should not be given the same weight as reality.
Oh, for sure not. But I think that this giving equal weight to feelings and facts has come out of some very good movements. For example, in parenting, in the 1960s, 70s, even 80s, if a child told you that they were feeling something or even had experienced something that didn't fit with your narrative, you just told them to shush, right? A lot of child molesters could take advantage of the fact that there were just certain things you didn't talk about and get away with stuff. Here's a great example, because I think a lot of your audience will be familiar with Sesame Street.
Yes.
So in the 1970s, there was a character on Sesame Street, Snuffleupagus, big elephant looking, right? Okay. Do you remember, because we're a similar age, do you remember that only kids could see Snuffleupagus?
Yes, I do remember.
And they would talk to the grown-ups on the show, and the grown-ups wouldn't see it. They'd be like, no, there's nothing there, right? Well, then Sesame Street Workshop realized they were setting a really bad precedent. And they made Snuffle, and what a lot of adults know is like, oh, now everybody can see Snuffy, and it's not like it was when I was a kid. Well, they did that because they didn't want to model for parents not believing a child who said something happened to them.
Oh.
And they didn't want to model for children that they could say something true and adults would blow them off.
Yes.
And that's a great thing that happened. Now we listen to children. When they tell us that something scares them, or that they are angry about something, or that someone touched them, or that something bad happened, they may not be telling the truth. And I hope that adults are, in a healthy way, a little skeptical, but we listen. We don't immediately push them away because they're saying something we don't want to hear. We have empathy for their feelings and recognize that their feelings are real for them. But somewhere in that, we started to say, my child's feelings are just as valid as anything else. And this is something I've been talking about for a decade in terms of the obstacle parents now face in trying to focus on our kids' happiness at any given moment. But in that same way, this idea of focusing on people's feelings as valid, and now we're talking about adults of a couple of generations who have been told their whole lives that their feelings are really valid and they should be accepted and they should be heard, they should be validated. And then they say, I don't want to wear a mask. That's valid. And it's just as valid as you wanting me to wear a mask. And that sounds like it makes sense until you say, but you're not wearing a mask isn't just dangerous to you. It's not just you riding a motorcycle without a helmet. The states that say that in the US, we have different laws by state. The states that say whether you wear a helmet or not is up to you. I guess, yeah. Even seatbelt laws, I totally believe in. As a doctor, I talk to everyone about wearing a seatbelt, but I think those are more of a personal infringement. You could make more of an argument that it's up to me than a mask law, because you wearing your seatbelt or not, that really has an impact on what happens to you. But you wearing a mask, that makes a huge impact on what happens to others.
Yes. Now, that's actually a very interesting point. Do you feel that, I'm here in Canada, you're in the US, our countries are similar, but they're different in some ways. We have some cultural differences. Do you feel that there is a pervasive anti-intellectualism happening there? So that's why a lot of people are disputing facts. And do you feel that it has to do as well with, because I know part of your constitution in the US is a lot about individualism, right? And your rights to do things and your right to, say things and carry weapons, et cetera. Do you feel that this is part of what's driving people in your country to not want to wear masks? Or do you feel that it's more the anti-intellectualism insofar as them not really believing that COVID is real? I mean, you mentioned that some people say that it's not real when they come into your office to see you.
I don't think that it's anti-intellectualism. I actually think that, so I want to point out from that historical standpoint that 100 years ago, in that worldwide pandemic, there were huge anti-masker movements here in the United States.
Okay.
100 years ago. So that's not new. And I think that points to what you're saying, is that we value I think it's one of the Dakotas, but one of our Western states here the governor really clearly said, we value liberty over life.
Okay.
And I disagree because, like I said, it doesn't just impact you. You're making decisions for others in your community or wider. But it was interesting to hear it put so baldly, because now I understand what they're talking about.
Yes.
And you can't come to a compromise until you really understand someone else's point of view. So I do think you're right that some of it is that stark individualism, liberty over life. So that's a piece. But I don't think it's intellectualism so much as I think it is option overload. Not knowing who to believe, not knowing what to believe, because there's so much coming at you. In the 70s, there were only a few places to get your information. Now there's truly, I think, an unlimited number of places to get people who say they are giving you information. The word information implies facts. It implies a nonpartisanship that isn't always the case. And the difficulty with parsing out who to believe, along with, and this is a little bit of neuroscience, but stick with me, along with everybody's in this hypervigilant cortisol state at the moment. No matter what you think is really happening, whether you feel under attack because of health concerns or financial concerns or political concerns, or the huge problem that we have with systemic racism, definitely in the US, although from my reading, arguably in Canada as well.
We have it
right?
here, unfortunately.
So systemic racism and like the heightened cortisol state of never knowing if it's safe to go outside, get pulled over, let your children out of your sight, right? All those things put people in this heightened cortisol state that's worse in 2020. And what soothes that heightened state is oxytocin and dopamine. And those are chemicals that our brain gets when we agree with someone, when we feel better. So if I read something that, from my point of view, could be just as valid as the other 16 things, if I give them equal weight because everybody's feelings are valid, then if this one makes me feel better, it becomes more memorable to me. It makes more of an impact on my behavior, and I want it more.
That is so interesting. I never even thought of it from that perspective about getting positive news. Basically, I think what you're saying is that we're in this heightened state of anxiety, rightly so, for many reasons. And when we get those positive, I guess, endorphins.
Chemicals, yeah. We get those good chemicals released in our brain, we feel better, and then we want more of that. And that soothes us. So if somebody is willing to say to me, hey, you don't have to worry about the virus. So I bring something that kind of represents that point of view. And I'm like, yeah, look, I saw this thing. And people are like, great, see, I read that too. And if I read it on the internet, if I can join a group that's lots of people, I get more oxytocin.
This is it, and it sounds like it's kind of like a self-fulfilling prophecy and a downward spiral for people who keep going into their echo chambers. And we all do it. I mean, I'm guilty of it as well. We all are, because I don't want to surround myself with people who don't agree, on the other side with facts and science. So if I have somebody, for example, in my social media, group who says, oh, coronavirus is a hoax, everything's a hoax, and, this is a big conspiracy and QAnon and everything. If I hear this, then I have to cut them off, because, and again, maybe that's fair, maybe it's not, but back to what you said a few minutes ago, both sides, in my estimation, are not equal. They're not equal, because a fact is a fact is a fact. And an opinion is just that. It's an opinion. And, I think that, we're in this position now where, we have to deal with our children and younger people who are growing up, again, with this plethora of information, because as you said, and rightly so, we live in a world of information. And now especially more so because we're at home. We're all online. We're not going out. So we're Googling everything, and we're going into Facebook groups and online groups and whatever, and adding to our echo chamber. So what would you say, doctor? So when you get these patients who come in and perhaps they have kids or, their parents or whatever, and they're saying, are you sure this virus is real? What kind of advice, like, how do you bring them over to your side to make them realize that, yes, it is very real and this is a very real threat?
So in the office, I do it differently than I do online, because in the office, I can lean on our relationship. Most people who come to see me the first time they may come because they could get an appointment, or I'm close to their home, or they heard from somebody that I was a decent doctor, or in my particular case, because I'm fluent in American Sign Language and I'm the only primary care doctor in like 300 kilometers who is, then they're coming just because I can communicate with them in their primary language. But I start the minute I meet somebody trying to build trust with them, trying to understand them, really showing them the respect that they deserve, whether they are 2 or 92, and creating rapport. Because then in the office, I can say, hey, it is real. And sometimes just the force of a doctor that they choose over and over and over again, right? So obviously they must not totally distrust me.
Trust, yeah.
Who has done right by them as best she could up until now, says, I get how scary it is and how hard it might be to believe, but it really is true. I'm behaving differently. I'm doing things differently with my kids. It's the same conversation I have with people who are hesitant or refusing vaccination. I say, whatever you believe, I'd like to add to one side of the pile to say, you probably believe I love my children. I vaccinate my children. And when you have a relationship with someone, sometimes that makes a little bit of a difference. But I also know that if I just say, okay, you're a moron, that breaks trust and that breaks relationship. And also, they're probably not a moron.
Yeah.
They've just decided to hook onto something that I think, that I know is based on trying to make people feel better and disregarding their health, right? Really putting their life in jeopardy. So I will say things like, I'm really scared for you. I'm really worried because you have this risk and your family member, whom I also take care of, right? This is the good thing about family medicine, is I do know everything about their whole family. I'm worried about your daughter because of this, or I'm worried about your parents. I know that you take care of your dad and I'm worried about him because of this. And so I'm really asking you to, and then I talk about actions. I don't ask them to change their beliefs. I ask them to change their behaviors, because one of the things as parents that I really, really remind myself of, we shouldn't tell people how to feel. First of all, it doesn't work, right? When somebody tells you how to feel, do you feel that way then?
No. And it's also, you get defensive, right? You get defensive.
Right. You get defensive. It's infuriating. It's disrespectful, and it doesn't work. So it's disrespectful and it doesn't work. So don't do that. Don't tell your kids how to feel or how not to feel. But we should not have rules about their feelings. But we have tons of rules about behavior. If my kid had a terrible day at school, they can feel that they hate school, that they're ashamed, that they're guilty, that they're angry, that they're jealous. They can feel whatever they want to feel. They can't slam my door and throw their backpack. They can't hit their little brother. They can't speak disrespectfully to me, but they can feel whatever their feelings are real, but their behavior, we need to have guidelines about. So I don't ask my patients to feel differently ever. I say, what I'm asking you to do is always wear a mask when you go outside and always wear a mask when you're around your elderly parents. And if you're willing, I'm asking you to ask them to do the same, because whatever you believe, I don't want you or them to die from this. And so when I can do that, we can ask them for behaviors, but I'm not telling them their feelings are wrong. I'm not even asking them to change their beliefs or their opinions. It does not always work.
So I know that you're doing a lot of work now, doctor, with resilience and talking to patients and larger society about how to be resilient. And I think it's such a timely skill to have, because I think we're all under a lot of stress. I'm sure in your practice, you're probably seeing a lot of people who are suffering from anxiety, maybe depression, because they're shut in, or, this whole thing about the pandemic, the fear, et cetera, et cetera. How do you teach people, and particularly parents with children, how to foster that resilience and go through what we're going through right now without that fear? Because we don't know how long it's gonna last in terms of this pandemic. If things continue the way it's going, it's gonna be a while. So what are some of your key talking points to that end?
I've written some activity books for parents about how to teach resilient skills at different ages. But really, the best thing about teaching resilience is you're already teaching it. I just want you to name it. When your child, okay, so you've had little kids. How do you feel about your 5-year-old who really, really, really wants a balloon? Most parents hate the balloon, right? We
Yeah.
hate getting our kids a balloon. Why do we hate getting kids a balloon?
Well, there's many reasons. Go ahead.
Right?
Go ahead. Yeah.
No, you tell me what's going to happen. I get my kid a
Well,
balloon. They wanted it so badly.
They might choke on it. If it's a helium balloon, then it might fly away. I mean, there's a number of things.
Right. So even if they're old enough that we're not worried about the choking hazard, because you're right. So up through age 4, no balloons, because they put it in their mouth and they can, I've seen this happen. Devastating. So if they're over 4, they're desperate for the balloon. They get the balloon. We have 3 possible outcomes. It's going to pop, fly away, or deflate. Right? Yeah. Balloons are disappointment on a string.
That you need to trademark that phrase.
Right? Well, I'm sure the balloon companies would not thank me, but I, as a resilience expert, especially about parenting, I love the balloon because it takes 72 different small disappointments for kids to be more resilient when they face large disappointments later in life. The 72. Balloon, the goldfish from the fair, getting sick the day of your friend's birthday party, losing the soccer game by 1 point. They're not small in that moment, right? They are 10 out of 10 upsetting for some kids in that moment, especially less resilient kids. It takes, according to some of the research, 72 of those experiences before kids start to learn to rate how bad it really was, and more important, start to be able to remember that they will ever feel better.
72. So that's actually specific research that you're citing. And
yeah,
what age do people like? So how long is it? Like, so is it at age 5?
In the first decade of life.
Okay, gotcha.
Right, so it's not 72 terrible days in a row. It's really bothered by it, and then they start. Whether it's 3 minutes later or 3 hours later or 3 days later, depending on the kid, they start to have fun again. As a parent, all you have to do, you don't have to tell them not to be upset about the balloon. You don't have to say, I told you this was going to go like this. You don't have to say, we're never getting a balloon again. You just have to say, oh, yeah, it is so disappointing. You wanted that and now you don't have it anymore. And that's really upsetting. I'm sorry. That's hard. Let me know if I can help you feel better. And you let them have their feelings. And then as soon as you catch them doing anything that distracts themselves in a good way, playing again, giggling, whatever it is, you say, wow, I'm really impressed with how resilient you're being. Because parents really hesitate to point out because they're like, well, I don't want to remind them about the balloon. They'll be upset again. That's okay. The thing that I think parents need to hold really tightly is that being uncomfortable is a skill. Managing discomfort, because, okay, so first of all, I have to back up and remind parents that being uncomfortable is not the same as being unsafe. When something is unsafe, we should believe children, we should step in, we should helicopter, right? We should prevent the actually unsafe. Where parents get tripped up is that we can't figure out the boundaries between unsafe, a child could be permanently harmed in some way, and uncomfortable, the child feels harmed right then. Uncomfortable is where we learn. It's where we grow. It's where we are changed. And kids have to learn and grow and be changed. That's growing up. So if I've reminded you now successfully that I'm not talking about unsafe, I'm talking about uncomfortable. Managing discomfort, boy, you have to be uncomfortable to start your own podcast. You have to be uncomfortable to ask somebody to go to the movies with you. You have to be willing to be uncomfortable to say to the police officer, can you give me directions? Right? You have to be willing to be uncomfortable to interview for a job. You have to be willing to be uncomfortable. And to be willing to be uncomfortable, you have to know that you have the skills you need to manage discomfort.
To this end, are you counseling some of your patients in your office with this with these facts? Like, do people come to you for counseling, or is it just?
No, I'm a family doctor. I see patients for their well checks and their medications and their high blood pressure, their ADD, those kinds of things. But the work that I'm doing from the stage, the work that I do when I consult for corporations about building resilience, the work that I do with committees and community groups is about this idea. Because, so how does this managing discomfort relate to the pandemic? You might be like, oh, duh, yeah, of course. But what I want to say to parents is I just want you to look at the pandemic a little bit differently. Every one of our children is experiencing upheaval and disruption to a degree that none of us, adults or kids, has ever seen, right?
Yeah.
But one of the things that we know, and Samantha, you know this because you've raised kids at who are different ages, all of our children will individually or in their family experience major upheaval and disruption in the course of their lives. We all do. A bad diagnosis, a job loss, the death of a loved one, a move, a deployment. I mean, a major weather event. There are all kinds of upheavals and disruptions that each of our kids will encounter as adults.
Yes.
But this generation of children, they're getting their first experience of upheaval and disruption with their parents by their side. Most of us don't get that. Most of us face upheaval and disruption once we're on our own. These kids are all getting the experience of having their parents, their teachers, their youth pastors looking at them going, hey, this is hard. How can we help? And they're going to learn strategies now that they will be able to translate and use every time they face upheaval and disruption in the future. There's a real gift in there.
Yeah. Yeah. I love that because, I've always long said that the best lessons that people learn, I know from my own life that I've learned are the most difficult ones, or maybe the most painful ones. Like, because they're seared into our brain, they're seared into our consciousness. And as painful as it might have been, we have learned lessons from them. So I think it sounds like that's what you're saying. If you can go through this, you can get past it. And, to kind of harken back to what you said about the balloon analogy, it's the same thing. Yeah, there's a lot of pain there and a lot of things might happen, but you've gotten past it and you've gotten over it. And sounds like a good message for parents.
Well, we don't need to wait until it's over because I'm not totally sure what that looks like yet or when it'll be every time. So I would say now, 9 or 10 months worth of people. So that percentage of individuals have had a pandemic birthday. Most of us have had a kid with a pandemic birthday, right? You can say, hey, I know a lot about your birthday really disappointed you, but I was really impressed how resilient you were finding joy in that one thing or that moment or the openness with which you approached a Zoom birthday party or a car parade or whatever might have been, or the card that you got from somebody that meant more to you this year. I really appreciated how you were able to notice that in addition to noticing your disappointments. Back to the balloon, we don't want to remind them of what was hard, but if we want them to learn from it, then it's a good thing to see them. Remember that was really hard, and not but, and you also found this to get out of it, or you managed this, or despite the fact that it was really hard, it was really hard and you weren't a jerk to your siblings. Way to go. That was really resilient. So when we point out to them these cycles that they're going through, there have been hundreds of disappointments, and disappointment is a really mild word for a lot of people during the pandemic, even if they were not directly impacted by illness or death, right? Yes. Major disappointments. And each of those disappointments, if your child came through it well, not came through it brilliantly, just it was yesterday and not today, and they do anything to be helpful, to be proactive, to distract themselves in a way that's not damaging, to be funny, you can point out their resilience. And now, because things have slowed down and contracted into our homes a lot, we have the time, the opportunity to say, okay, in the midst of all of this frustration, sadness, fear, is there anything good? That's a really good life lesson for our kids. There will be other times where they will get stronger if they can look around at stuff that's really hard in their own lives and say, all right, is there anything worthwhile happening here?
I love that. And I love how you are talking on a positive note. That's probably a good way to end things because you know what? I always want to end on an up note. So I just want to thank you so much for being here on the podcast, Dr. G. And before we wrap up, can you tell everybody where they can find you, what your social media handles are, your website, your books, all of that stuff?
The easiest way to find me is my website, which is askdrg.com. So if you go there, you'll be able to find any of those other things that you might be looking for. And I hope it's not too hard to remember. AskDrG.com.
AskDrG.com. And I will be sharing all of your social media sites and your website on the Parenting Then and Now podcast webpage, as well as in the show notes for this particular episode. So thank you so much for being here. It's been such a pleasure to talk to you, and stay safe.
Stay safe.
It does seem that we're getting to see the light at the end of the tunnel with COVID. Yay! So glad it's finally here. That being said, we can't let our guards down when it comes to resilience and taking care of ourselves. Thank you so much, Dr. G, for giving us your insight and your wisdom and your support and guidance through this difficult time. And we look forward to listening to your advice as we get out of this pandemic and get into other aspects of our lives.